Parliamentary records reveal timeline of vaccine safety signals, Canadians now asking questions about informed consent. CCJ News, Accountability Report. Recent parliamentary written responses from the Government of Canada are shedding new light on how regulators monitored myocarditis reports during the COVID-19 vaccine rollout. These documents, tabled in response to questions from members of Parliament, provide an official timeline of when safety signals were detected and when warnings were communicated. According to the government's response, Canada's adverse event monitoring systems recorded early reports of myocarditis and pericarditis following vaccination by February 27, 2021. International pharmacovigilance meetings among regulators discussed the emerging signals soon afterward. The timeline outlined in the parliamentary response shows how events unfolded. December 2020, Canada authorizes the first mRNA COVID-19 vaccines and begins vaccinating priority groups. January to February 2021. Vaccination programs expand to older adults and high-risk populations, while safety monitoring systems begin collecting reports. February 27, 2021. Early myocarditis and pericarditis reports are recorded in Canada's monitoring system. March 2021. International safety meetings among regulators discuss the emerging signal. April to May 2021. Vaccination expands to younger populations as more doses are administered and more safety data becomes available. June 3, 2021. Canadian healthcare professionals are formally alerted about the potential myocarditis risk. June 14, 2021. Public health websites update safety information to include myocarditis and pericarditis. June 24 to 25, 2021 Health Product Info Watch bulletins are distributed to physicians and pharmacists. June 30, 2021. A public advisory is issued and vaccine product labels are updated to include myocarditis and pericarditis as potential adverse events. Government officials describe this sequence as part of the normal pharmacovigilance process used to monitor vaccine safety. However, the timeline raises serious questions that many Canadians continue to ask. If early safety signals were already being monitored by February 2021, why did it take months before the public was formally warned? Were Canadians given full and clear information about potential risks when they were asked or required to be vaccinated? For many workers across the country, vaccination became a condition of employment. Some Canadians say they were denied exemptions, faced job loss if they refused vaccination, and were not fully informed about emerging safety concerns when making their decision. During the pandemic, some physicians and researchers also reported difficulty publicly questioning vaccine policy or safety monitoring without facing professional consequences. Critics argue that limiting open scientific debate can erode trust in public health institutions. Health authorities maintain that monitoring systems worked as intended and that decisions were made based on the scientific evidence available at the time. But for Canadians who feel they were pressured into medical decisions without complete information, those explanations have not resolved the underlying concerns. Questions Canadians are now asking. Did your doctor or pharmacist provide full informed consent before you received the COVID-19 mRNA vaccine? Were you clearly informed about potential adverse events, including myocarditis or pericarditis? Were medical exemptions fairly considered when people raised concerns about their health? Did you feel you truly had a choice, or were workplace mandates and government policies a deciding factor? And another question many Canadians are now asking themselves, did you experience any new or unusual symptoms after receiving the COVID-19 mRNA vaccines? Informed consent is a fundamental principle of medical ethics. It requires that patients receive clear information about both potential risks and benefits before agreeing to a medical treatment. For some Canadians, the pandemic raised serious concerns about whether that standard was consistently upheld. Transparency and accountability remain essential to rebuilding public trust in health institutions. Canadians deserve clear answers. This is the Canadian Citizens Journal.